Do you wish, though, that the president had posted his bill before this week, that 6 months ago it might have been more helpful for you, that maybe 6 months ago you knew that the public option was something he was willing to drop before you fought so hard for it?
Well, we still fight for what the public option will do. Whether it's in the bill or not, its purpose must be recognized, and that is to keep the insurance companies honest, to keep them accountable, and to increase competition. And I think in the summit on Thursday it became very clear that what the president was proposing was regulation of the insurance companies. Left to their own devices, they have done harm to the American people. They need to be regulated, and that is one of the biggest differences between the Democrats and the Republicans. Another one, for example, is an example of it is ending the denial of coverage to those who have a pre-existing condition. The Democrats have that in their bill. The Republicans do not. But that's a major insurance reform that has to take place.
But would we still be debating this if the president had put his plan out 6 months ago?
I don't know what the value is of trying. The president has tried since 1 year ago, March 5th. We met in Washington, D.C. in a bipartisan way with some of the outside stakeholders to talk about working together to have health care accessible to all Americans. I smile because I remember Senator Kennedy coming into the room and saying, "I'm signing up as a foot soldier in the fight for health care reform." And of course, he was such a tremendous leader. But that was a year ago. Since then, we've had hundreds of hours of meetings and hearings and markups of bills. Well over 100 Republican amendments are in this bill, the House and Senate bills, and what the president put forth. We'll see if some of what was said yesterday, for those who were making constructive contributions, can be accommodated. Whether we get Republican votes or not, the bill definitely has bipartisan provisions in it. But if they have a good idea that works for the American people, whether they're going to vote for the bill or not, we want it in the bill.
How long are you willing to wait for those ideas?
Well, that happened yesterday.
It made it clear that the president seemed to make it clear that time's up.
Time's up, yes. So we really have to go forth because, as I said there, as we sit around this table, this big table in Blair House, every night families sit around their kitchen table, try to figure out their finances, the security of their jobs, the cost of their children's education, how they're going to pay their medical bills, what is the status of their pensions, and they can't wait any longer. If you have, if your family has a pre-existing condition, or if you are denied coverage, or if you have a rescission, if your insurance has been withdrawn just as you're about to need a procedure, you know that it's long overdue. And what's the point of talking about it any longer?